Good morning. I'm Charles Briscoe, I'm President and CEO of Houston Healthcare. And it's my privilege this morning to be joined by my colleagues that you'll hear from shortly to discuss the COVID pandemic in Central Georgia with you today. Stand here looking at a beautiful scene of Macon, Georgia. And unfortunately, we're also in a situation where the COVID pandemic continues to wreak havoc on our healthcare system. And that's the message we want to bring to you today, is that the pandemic in Middle Georgia is still very much in place and still very much a challenge for your local healthcare systems. At Houston Healthcare today, we have 85 patients. Just a short month ago, that number was 7. So the spike has occurred. Numerous of those patients are in critical care, some are on vents. And the real message I want to get out to you today is that of those, the majority of those in the hospital, and almost all of those on the ventilator and in the ICU today, are unvaccinated. You know, we've been through this. This is now our 4th wave, as we call it in the industry. And each wave has had its own unique characteristics that we've had to adjust and battle as a community, as a healthcare system and an industry. In this 4th wave, for me, that I would like to get out to you and to the citizens of Houston County and Macon-Bibb and those surrounding areas, there's a couple of words that come to mind when I think of how we're going to describe this 4th wave. And those words to me are first and foremost preventable, it's human capacity, and it's human compassion. So I would ask you today to please consider getting vaccinated. We're here today, I think I speak for my colleagues, we're not here today to have a political debate. We're not here to debate the pros and cons and all the rhetoric that's out there on the television and on social media. Today is about what we see in our local community. And what we see consistently is those individuals who are unvaccinated are at great risk of hospitalization, severe hospitalization, and at a greater risk for death. So I'd encourage you to get vaccinated. What we're seeing is preventable. The 4th wave is preventable. We can get back to our normal lives. And then there's human capacity and human compassion. Our nurses and healthcare providers are worn out. This is their 4th wave. And just think about that. With the spikes in care and the system being overtaxed with the capacity constraints, our nurses, our respiratory therapists, everybody at the hospital are worn out. They're leaving the industry. They continue to stand that and take that post every day for you, whether you're sick with COVID or you're sick with something else. They continue to take that post every day and say, we're there for you. And God bless them for doing it. Unfortunately, they're also catching a lot of the heat of the rhetoric that we see in our community. And I would ask you to please consider, if you have a loved one in the hospital, and yes, we are on some pretty strict visitation because we're in the 4th wave. Please remember, these individuals, again, are taking a post to protect you and me, regardless of what brings us to the hospital, and to protect your loved ones. So please be respectful, please be kind and compassionate to those healthcare providers. So it's preventable. It's a human capacity concern for us. We're struggling to staff the beds that we have. And please be compassionate and kind with the healthcare providers. Thank you.
Good morning, I'm Steve Doherty, CEO of Piedmont Macon and Piedmont Macon North. I'm here today with profound sadness, and I'm sad for the families and patients in our hospitals suffering from COVID. I'm sad for our community that is being impacted again for the 4th time. There's really no need for this sadness. As Charles has already mentioned, this is preventable. We don't need to be here. I hope the community sees Charles Briscoe and Steve Doherty and Vecchio Finlay as advocates for their cities and for Middle Georgia. That's why we're here. Again, not as competitors, but trying to reach into the depths and say, we have to take care of our community. And that's more important than competition at this point. In the first 3 waves, we had people cheering for us, and we appreciated that. We had people praying for us, and we appreciated that. But I want to tell the community what one of our nurses told the media yesterday. What you can do for us now is get vaccinated. We don't need meals. We don't need personal protective equipment. We don't need ventilators. We need our community to come together and protect each other. Our country, our communities have done that over time. In wars, people went and gave their lives, not for themselves, but for their country or their communities. And those people that didn't go to war stayed back and rationed gas and food, not for themselves, but for the greater whole. And that's what I'm imploring on Middle Georgia to do today, is step outside yourself, look at the data, and make a choice for your family, for your neighbors, and for those people that you don't know. Because our hospitals are full of people, again, that don't need to be there. We've never said that the vaccine was perfect. We knew when we started administering it there were going to be some people that were vaccinated that still got sick. But what is clear and what is overwhelming is that even if you get sick and you're vaccinated, the illness is going to be largely less severe, and you have a great chance of surviving it. So I hope that the next time we come, that we will celebrate what Piedmont celebrated in early July, and that is having 0 COVID patients in our hospital. But the only way we're going to get there is for our community to come together and get vaccinated. Thank you.
Good morning. I'm Vecchio Finlay. I'm President and CEO of Atrium Health Navicent here in Macon. And like my colleagues, I'm here to ask, to implore all of you in the community to help us, to help you, to help one another, to help all of us. You know, as Charles and Steve have indicated, vaccinations is our proven best method, not perfect, but our best method of ending the spread of this deadly pandemic, this deadly virus. You know, vaccines are approved for individuals age 12 and up. And to that end, I'd like to speak just briefly, not just as a healthcare administrator, but also as a parent. You know, we're in this very interesting time, exciting time for all of us, that we're sending our kids back to school and wishing them well. And like me, maybe some of you have kids who are under the age of 12 and so can't get the vaccine. And while they may mask and social distance and practice all the COVID-safe behaviors that we've been encouraging, they are at risk. And we should be concerned, all of us should be concerned, for them, for medically fragile adults, and we can do something about it. And that thing is to ensure that as many of us as possible, age 12 and up, get the vaccine. You know, we're seeing today that this Delta variant is much more impactful to kids than any prior version of COVID. Right here at Beverly Knight Olson Children's Hospital, here for Atrium Health Navicent, we're expanding our immediate care capabilities for children who are now requiring hospitalization because of COVID. This time last year, we were seeing positivity rates of around roughly 2%. Today, that number is closer to about 23%. And if I could speak briefly to our younger adults, so those of you who are in the workforce, or maybe you're in college here at Mercer or at Central Georgia Tech, Middle Georgia State, Fort Valley, any number of schools. As was said before, this particular peak that we're experiencing is trending more towards younger adults as well. So we need you to do what's right for you, to do what's right for your friends, your families, your neighbors, as we said, people you don't know. You can get the vaccine, you can continue to practice COVID-safe behaviors. You know, our hospitalizations are mostly the unvaccinated, overwhelmingly the unvaccinated. And that becomes increasingly so when you look at those who are in the intensive care unit, and almost exclusively for those who are requiring the use of mechanical ventilation just to breathe, the unvaccinated. So we really, we have doctors and nurses who, when I talk to them, say, we have patients who are in their moment of suffering, sometimes in a life or death situation, asking, what could I have done differently? What if? So again, we say the thing that all of us can do now that we couldn't do before is get the vaccine, continue to practice COVID-safe behaviors. As we said before, this is not just about COVID. Our systems support care for the entirety of our community and the continuum of needs for our communities. As you know, in addition to being the only level 1 trauma center between Atlanta and the Florida state line, we are the only children's hospital between Atlanta and the Florida state line. And our trauma centers need to take care of people when minutes matter. We do not want to be in a position where we're sending people in our community who need that care the most outside of our community to get that care. So we are doing things, we're taking a very tough decision, just as many of our colleagues and organizations across the state and the country are doing, to try to alleviate the pressure that we are experiencing now. We are once again temporarily halting elective procedures that require hospitalizations. And this is helping. It's helping to reduce some of the pressure, and it's helping to relieve some of the long waits that we're experiencing in our emergency rooms. But it is not enough. So again, we need you to help us, to help you, to help all of us. Now, while we're here to encourage people to get the vaccine, we also want to take a moment to thank those in our community who have done so. We've done that through our sites in our wellness center on Northside Drive. We've done it through drive-up vaccination sites at our family health centers. And we've also helped to support those individuals who are experiencing disparities or challenges in getting to those vaccination sites. We've partnered with community partners like our public health agency, our school districts, to get it to homebound individuals, to seniors living in public housing, to the homeless, and many, many others. But there's still more vaccine now available, and we need people to actually get those shots. So what can you do if you don't have the vaccine already? Go get the shot. Take a family member with you. Meet a friend there. Get these shots. And I'll tell you, this Tuesday at our wellness center on Northside Drive, we'll be holding another vaccination drive, and we encourage you to come to get those vaccines. It'll be a pop-up clinic on Tuesday afternoon at the wellness center, again on Northside Drive. You can sign up for appointments to get those vaccines at www.covidsafega.org. Now, if you can't go on Tuesday, please go any other day. And you can find out other sites to get those vaccines by visiting the Georgia Department of Public Health website at www.dph.georgia.gov/COVID-vaccine. So finally, I too want to thank all of our frontline heroes, whether they're at Atrium Health Navicent, at Piedmont, at Houston County, and all other places, our public health departments and others, for standing on the front lines day in and day out and supporting our communities for more than a year to address this deadly pandemic. But as we said, as a community, you can help us. You have the power to help us to spread this disease, to help us to stop the spread of this disease by joining us in rolling up your sleeves and getting vaccinated. Thank you.
Good morning. My name is Dr. Jimmy Smith, and I serve as the administrator of the Macon-Bibb County Health Department, which is one of the 13 counties under the leadership of Dr. Renee Haynes for the North Central Health District. I'd like to also start off by thanking my colleagues in healthcare who are here today from our local hospitals. We in public health appreciate the tremendous work every one of your staff has put in over the last 18 months to this pandemic to assist the people, the families, the communities that have been touched by COVID-19 in some way. We also want to commend you on your own COVID-19 vaccine operations. While we are currently seeing the impact of the rise in those cases, we believe we would be at a much lesser position without our vaccine outreach from hospitals, community groups, and public health over the last 7 months. So thank you again, because our efforts have been multiplied and certainly have community impact. For our community members here in Bibb County and across Central Georgia, we at Public Health echo the message of our hospitals. Please get vaccinated against COVID-19. Let me say that again. Please get vaccinated against COVID-19. Central Georgia has continued to fall behind the state's vaccination numbers. While Georgia records a 41% of its population fully vaccinated, our 13-county public health district has only achieved 34 to 35%. Cases are rising across our district. We've seen a 200% rise in new cases at the beginning of August. All 13 of our counties are experiencing substantial spread of COVID-19. I know our community, and I know we can do better. We continue to be challenged by a virus as new variants are discovered. Per CDC, the Delta variant has become the most prevalent strain of the virus across many states, and that does include Georgia. We should expect this variant is here in our area, and we should take action to stop spreading it any further. Though COVID-19 prevention practices have been part of our lives for a year and a half, we know that there are parts that everyone can participate in. With Delta being shown to be more transmissible, we can all use that extra defense. However, we have a major advantage that we did not have at this time last year. We have a COVID-19 vaccine. One of our greatest challenges to improving this coverage is something I'm sure everyone has encountered since the first pieces of COVID information were shared, and that challenge is misinformation. Whether it's rumor or fabrications, we have seen cleverly made, flashy, professional-looking things all across the internet, but contain zero truth. Much like a virus, a well-told untruth can spread like wildfire under the right conditions. This is a hurdle that is constantly evolving, especially as we receive new information regarding the vaccines every day. We ask that you talk with your healthcare professionals about getting the vaccine before putting all of your faith in a picture on social media. Education is one of the cornerstones of public health, and sharing facts with people can only help them make an informed decision. Here are some of the facts about COVID-19 vaccines. The vaccines cannot make you sick with COVID-19. The vaccines do not impact fertility in men nor women. The vaccines will not change your DNA. Most importantly, the vaccines greatly reduce your risk, as my colleagues have said, of severe symptoms of COVID-19. The COVID-19 vaccine is available. The COVID-19 vaccines are free. COVID-19 vaccines are our way out of this pandemic. Please get vaccinated against COVID-19. And now my colleagues and I are available as a group to answer your questions. Yes, ma'am.
So at the beginning of this pandemic, we talked about a people line and how if we got to a certain line, remember the graph, if we got to a certain line, our healthcare systems would be overwhelmed. How close are we to that line right now?
I'll let my colleagues speak to the health system's perspective of that. In terms of reaching that line, I think, as you mentioned early on when we started this, we were dealing with COVID, which I call COVID 1.0 because it's changed so much. But I think as these variants have developed, then that line is also going to have to shift. So with that, my best answer for you is right now, we don't know. So the thing is, that's why we're encouraging folks to get vaccinated, put every piece of defense you have in front of you, including not only vaccines, hand sanitizer, washing your hands, social distancing, limiting yourself in large groups, and then following the recommendations of the local authorities and folks in your community.
So for Piedmont, I will tell you that we are over capacity. This morning we expanded critical care into an area where we normally recover surgical patients. So not only are the patients that have come in to seek treatment continuing to get sicker, but we are also postponing surgery. Now, we call that elective surgery, but I think everyone knows that nobody has surgery just to have surgery. That it's necessary, and unfortunately, we're now having to make decisions to delay care because of the burden that COVID is putting on us. As one of my colleagues said earlier, it's not just the load of COVID, but it is the toll that this has taken on our frontline workers over time. So through 3 waves, we had people that retired early, we had people that left the profession, and we have our own staff that are being affected by this as well, either having to take care of loved ones or getting symptomatic themselves. So I think we're at or near that line, but I will tell you that our staff continues to step up. We're continuing to innovate on how we can take people in and make sure that they get the care that they need, but it is a struggle. And I'm not ashamed to tell you, I get pretty emotional when I'm by myself thinking about what's going on at my hospital and not really being able to make an impact for those people that are watching people suffer. So I'll turn it over to my colleagues.
All of your hospitals are currently on diversion. Last check before we came out today. Let's say hypothetically any one of us is in a wreck out here where they're reconstructing the interstate today. What does that mean for us if we have to get loaded into an ambulance and we need trauma care?
So thank you for the question. I think it's a very important question for us to share with you and with everyone who's listening. So we are actually currently, as Level 1 Trauma Center, we're not on trauma diversion. We're on, there are other types of diversion for other levels of care that we aren't able to accept and treat right now. But as a Level 1 Trauma Center, happy to say that we are not currently on trauma diversion, but we were recently. And it's the first time that we have been for years. We don't take it lightly, again, because minutes matter. You just made an excellent example of any number of traumatic events, falls, really serious exacerbations of chronic conditions where we have to be available. And our teammates are there wanting to provide that excellent care, but they're overwhelmed by what's happening right now. Again, that's avoidable. We will always be there for our community. We'll always do the best we can, but we want to be able to provide the best care possible. And the impact that we're experiencing right now is compromising our ability to do that. So we really want to acknowledge that they will do this. And when you come to us, you should know that you will get the very best care we can offer to you. We just want to make sure we can do that more readily, more reliably for as many people as possible.
One quick follow-up.
Sure.
Other types of diversion that you are under right now, the NICU is in diversion. So no NICU ambulances right now to the pediatric hospital.
That's right. So what that means is that then we have to send people outside of the community to other parts of the state, and in some cases outside of the state, wherever the available level of need or type of care that individuals need.
Where would that be if it's not here?
It could be in Atlanta, it could be in Florida, it could be in Augusta, it could be in other parts of the state. But again, that's the reason why we want to make sure that we as a community are coming together to do what we can, and we have this great opportunity now to do something we couldn't do last year. And unfortunately, that's combined with the increasing pressure of the cumulative toll that this is taking on us on a capacity basis as well as a demand basis. So one more reason, please get the vaccine. Thank you.
I actually have a question. For anyone, and anyone can answer this, people go to the hospital for just about anything. So what should people be going to the hospital for, and what shouldn't they be going to the hospital for right now?
So I'll allow my colleagues to answer, but I do want to just take this opportunity to say I am not a physician. I have the privilege of working alongside many of them, including Dr. Smith, all the time. And I will say, so if you are experiencing symptoms and you're concerned about whether you're in an emergent situation, you should you should seek care. If you are interested in getting a COVID vaccine or getting tested to have COVID without being symptomatic, the emergency room is probably not the place for you to be. In fact, that actually then compromises the availability and the length of time it takes to care for those individuals who are experiencing true emergencies. But that is a decision that is individual and case-based, and I will submit that I am not a physician, but if you have that ability to make that judgment, to reach out to your PCP via virtual means or telephonic, calling offices, going to an urgent care center. We have many of those across our markets. Going to your PCP, those are better alternatives unless you're experiencing true emergencies, but I'll allow others to add as well.
Thank you, Del Vecchio. He answered it perfectly, and the hesitation you may have heard is there are rules that we live by that govern access to the emergency room. So the answer to your question is, if you need emergency services, please come to one of our emergency centers. However, in the confines of what we're talking about, I would encourage you, as Del Vecchio said, just to speak to your primary care physician. Consider other alternatives. But if at any time you feel like you need an emergency room, we are there for you, but you will run into the situation we have described. And I would like to, just one second, I want to go back to your question earlier too about this notion of capacity and the graph of the cases and that kind of thing. I think Steve answered that beautifully. I won't rehash that, but I wanted to kind of give maybe a different angle on that. Because the community may be wondering, okay, you're saying get the vaccine. So what size is that lift? What does that mean? What is the challenge to the community? I will give you the Houston County numbers, and I would suspect Macon-Bibb is very similar, given the similarity in size. But in Houston County right now, we have about 53,000 people out of 162,000 that are vaccinated. And we've got just under 12,000, if memory serves, that have had COVID. And if you've had COVID, the research says you have some protection, but you ultimately need to get a vaccine. So let's say 53,000. If we need 80% to have effective herd immunity, we're talking a lift of about 75,000 to 80,000 incremental individuals in Houston County alone that needs to get vaccinated. And again, I would submit the Bibb County numbers are probably very, very similar. So I just wanted to take that opportunity to identify the lift that we are talking about. This is not simple. This is not one section of town. This is all of us. All of us.
Yeah, this is a follow-up for all of you hospital administrators and Dr. Smith. Just based on what we know about poverty in our area, I feel like the majority of people don't even have a primary care physician. So in some sense, aren't we cutting off, haven't we all together as a community cut people off from their first choice for medical care when they need it by cutting them off from emergency rooms? This is not a knock on how you're running your emergency room. This is saying something about how what we need to do so people can get, their heart checked out when they have a panic.
Yes.
Like this notion that we're supposed to go to our primary care physician seems kind of fallacious on its face.
Well, and that's a much larger question than just the COVID, but I would agree with you. Poverty, homelessness, those things that we struggle with in our communities is a real concern. And I know within our industry, as in other industries, diversity, inclusion, access to care is a number one priority for all of us. And we are in a community where even in good times, there are shortages of primary care. Whether you are in poverty or you're not in poverty, there are significant shortages of primary care physicians. I would say this problem, back to COVID, exacerbates that situation. I would agree with you. But I would also say when it comes to vaccine clinics, I know at Houston County, we have made a particular effort to reach out to those communities that may have low access to education, low access to the vaccine itself, to try to remedy that problem the best we can, because we realize access is a significant problem for many in our communities. I'll let Steve and Vecchio speak about their efforts, but that is a valid point, a great point. absolutely not lost on your local healthcare systems and your physicians, and we are trying every day as a part of our missions to solve that problem.
Does anybody else want to speak to how we as a community can let people see a doctor?
Sure. I think often, and I wish we had a representative here today, and maybe that's an oversight, is there are federally qualified health clinics in Middle Georgia that operate on a sliding scale. So whether you have no money or you're like one of us and insured, they see all comers. Macon Volunteer Clinic as well can serve people that don't have a primary care physician. So I think we should probably work together to get that resource out to you at the media and make sure people know where they can see a primary care physician. But again, we would say if you think you are sick, then please go to the emergency department.
Great question, and I would add to that. There's no